Hello, my name is McKayla Leggett, and this is my presentation on my internship project for the School of Public Health Master's Program. My internship project was to design, pilot, and evaluate a nutrition education program at Bristlecone Recovery Center. Bristlecone Recovery Center is a private, nonprofit agency that was established by combining two treatment centers in 2002. BRC specializes in treating drug, alcohol, and gambling addiction through a full range of treatment services. Below are the agency's vision, mission statement, and values. The CDC and National Institute on Drug Abuse reported that substance abuse has remained a significant problem in the state of Nevada, with both overdose and drug-related death rates rising each year. Previous research has shown that treatment programs that teach clients lifestyle skills, such as proper nutrition intake and preparation, have been more effective in reducing relapse rates. The purpose of the Client Nutrition Education Program was to contribute to reducing relapse rates for the clients at Bristlecone Recovery Center by educating the residential clients on the basics of nutrition and teaching them the relevant skills and behaviors necessary to equip them to be successful in managing their diets. The project included researching successful nutrition education programs, updated nutrition guidelines, and the agency's background, demographics, and needs. Additional research was done to identify the resources needed to support the project and which stakeholders should be involved. Once all of the content was gathered, the program was created and the staff was trained on the implementation. The Client Nutrition Education Program was taught over 6 weeks, and data measuring the impact was gathered, analyzed, and reported. Future recommendations for the program were included in a draft report based on the project findings, and revisions to the program were made for future success. The program consisted of a presentation with 62 slides covering the topics listed here, as well as skill-based activities to practice what the clients had learned about food identification, meal planning, and meal preparation. This work impacts the future of this public health issue by revealing the gap in services aimed to improve the nutrition knowledge and dietary habits of the target population. More and more research supports the significant impact nutrition has on mental health, motivation, cognition, and substance seeking, all of which directly affect addiction and recovery. The following are the NPH competencies I achieved through my internship. I began by establishing expectations, goals, and activities that would elicit the desired behavior changes and defined how the success of the program would be measured. I then assessed the needs of the agency and target population through observation, interviews with my preceptor and key stakeholders, and evidence-based research in creating a foundation for what should be communicated and how. I was then able to apply my awareness of the cultural values of Bristlecone Recovery Center and its clients in designing the nutrition education program. The content and design were chosen based on the research and cultural appropriateness so that the program had the highest probability of being successful. I practiced oral and written communication of audience-appropriate public health content. The oral forms were the presentation, and the written forms included emails, meeting notes, research outlines, program draft, the pretest, the post-test, and the food identification quiz. The Client Nutrition Education Program pilot was successful and made a lasting impact on the agency. The program showed to be successful by a 17% increase in the group's average score, from 63 to 80% on the pretest and post-test respectively. Many of the individual question scores increased, demonstrating a knowledge change in the subject matter. BRC has chosen to continue the implementation of the program and is considering the recommendations outlined in a draft report for better retention and results. My internship was a valuable professional and personal experience and exceeded my expectations. I gained a thorough understanding of how nonprofit public health agencies operate and how a public health professional should be resourceful monetarily and with relationships and collaborations. I learned that most employees in the public health field, especially those serving vulnerable populations, are predominantly driven by their passion to make a difference. The most valuable lesson for me as an emerging leader in public health was to recognize and celebrate the small wins, and that change happens over time by multiplying those wins. I may not have succeeded in every client making a permanent positive dietary change, but I did educate, increase awareness, identify a gap in treating this population, and create a program that will be adopted by the agency. Thank you for joining me in this presentation.